Welcome to Today's Workplace, a podcast created to keep employers current on the latest employment law trends while providing proactive solutions to the everyday issues arising in today's rapidly changing workplace. Is your business prepared for today's workplace? Let's find out with your hosts, Barbara Johnson and Belinda Reed-Shannon.
So many people in this country have been severely impacted because of COVID-19. And many of us have been dealing with working from home for more than 4 months because of the virus. Yet a lot of misinformation abounds, and it's caused an unprecedented disruption to society and business globally. Just as we thought we were ready to open things up and start returning to work from home to the workplace, there have been tremendous spikes in some areas of the country. Before we examine the specific impact of COVID-19 on the workplace, we want to have a way to put it all in perspective and understand what is this really about. And so today we have a very special guest who's going to provide us with a lot of information and a lot of perspective on what we know today as COVID-19. So Barbara, why don't you introduce our very special guest today?
Thank you so much, Belinda. We are so fortunate today to have with us Dr. H. Westley Clark. He's the Dean's Executive Professor at Santa Clara University. And Dr. Clark, as I said, has just the perfect background because not only does he have a bachelor's degree in chemistry from Wayne State University and a medical degree from the University of Michigan School of Medicine, he also has a master's in public health that he obtained from the University of Michigan School of Public Health. And on top of that, he has a law degree from Harvard University. So as I said, the perfect person to talk with us today as we explore some of the scientific issues and public health issues around COVID-19.
I agree, Barbara. That sounds like a perfect background for this discussion. Hello, Dr. Clark.
Hello, Belinda.
Hi.
How are you?
I'm doing great. I think the best way for us to get started is for you to explain, for those of us who are the non-scientists in our listening audience, why don't you tell us what exactly is COVID-19?
Well, COVID-19 is the name of the disease caused by a virus called SARS-CoV-2. COVID-19 was so named because it was first reported in 2019, and the name was assigned to it by the World Health Organization. It is a member of what is called the coronavirus family, and as a result, it is the SARS component, which is severe acute respiratory syndrome, and it's the COVID-19, the second COVID.
Oh, okay.
Virus.
So when we were first made aware of it, what was the reaction in the scientific community?
Well, we weren't made aware of it until December of 2019, when China alerted the WHO on a cluster of pneumonia cases of unknown origin. This was in Wuhan, China. Mm-hmm. And then WHO by January realized that we were dealing with this new virus or novel virus of the coronavirus family, and it was labeled, as I mentioned. So then in January of 2020, we had the first confirmed case of COVID-19 outside of China. It happened in Thailand, and it was to a traveler who had visited China. By February, we had a confirmed case outside of China in the Philippines of a Chinese man from Wuhan. And then, of course, we've continued to have cases in multiple countries around the world. And February 14th, Egypt reported its first case. And then we've had cases reported in Iran and Italy, and then, of course, just about every country in the world.
So this is something that immediately was recognized as having global impact and not just any one country?
Well, we very quickly became aware of the global impact by being able to track the presentation of the virus in different countries. And so by March, the WHO had labeled this a pandemic, mid-March. And by pandemic, I mean this was a disease that was occurring in multiple countries and needed to be viewed in that context. Because you also had to step up your assessment of people who presented in the emergency rooms for various reasons associated with this.
Did at that time, did the World Health Organization have any idea how fast this was spreading? So they knew it was presenting in global communities everywhere, but did they have any idea how rapidly it was spreading within any one area?
Well, certainly given the historical experiences with these respiratory infections, they became aware by mid-January that this was exactly happening, as you pointed out. As I pointed out, people who had been in Wuhan had traveled to other places, wound up symptomatic. So in January of 2019, WHO declared the outbreak a global public health emergency because by that time, more than 9,000 cases were reported worldwide, including 13 countries outside of China. So, and then February 2nd, the first recorded death outside of China was reported, as I mentioned, in the Philippines. So if you had multiple cases, multiple countries, and then people were reported dying outside of China. So yeah, I think WHO was very much aware. But remember, it's late December, and so by essentially 30 days later, that gives you a sense of how rapid this and how infectious this disease was, or is actually, not was, still is.
Okay.
At what point did we officially have a pandemic? And tell us, what is a pandemic?
The difference between a pandemic and an epidemic is not clear. It's a little vague. Generally, an epidemic, which also doesn't have a precise definition, is when you've got multiple jurisdictions and a lot of people who are affected by a condition. And historically, it's been an infectious disease, but we've heard the phrase epidemic applied to opioid overdose. We've heard that phrase applied to other circumstances. A pandemic, of course, would suggest a more global presentation, multiple countries, and as well as many people in multiple countries. So the key issue is it's happening in a lot of places to a lot of people.
Okay. But let's talk about how COVID-19 affects people. What are the symptoms, and has our understanding of the symptoms evolved over time?
And I'm glad you raised that question because, again, you've got a rapidly evolving situation where, first of all, we have no prior experience. The medical community, the epidemiologic community had no prior experience with this particular virus. It is called a novel coronavirus for that reason. The word novel meant that it had not happened in human beings before. So the symptoms that appear 2 to 14 days after exposure to the virus include fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headaches, loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, and diarrhea. The sort of classical symptoms seen in emergency rooms would be trouble breathing, persistent pain in the chest, and some sense of confusion, inability to stay awake or to get to sleep, and then bluish lips showing some sense of oxygen, low oxygen in a person's blood.
And what is the progression of the disease? I mean, we know that it's a disease that actually can kill you, but how does it progress?
Well, again, most people just have the symptoms that I talked about in terms of the fever, the headache, the shortness of breath, and they get better. So roughly 80 to 85% of people have symptoms that trouble them, but they get better. In fact, that's part of the problem because most people treat it like the regular flu that many of us have had and have treated symptomatically, maybe with a decongestant, maybe with an analgesic like Tylenol or an aspirin. But there, as it progresses, you start getting the increased difficulty with breathing. And as I mentioned, sort of physical signs like blue lips, or until you wind up going to the emergency room because you can't breathe. And then it gets, it either gets better or worse, but mostly the respiratory problems. Now, the disease can manifest itself in a minority of people and a full range of things because it can affect multiple organ systems. And that's something that we have to keep in mind. It isn't just the pulmonary issues, that you can have multiple organ systems involved, your heart, as well as your lung and other organs. So when you ask how about the disease progression, you want to look at the full range of the clinical presentations.
Okay. You know,
I was just going to ask, so once we identify this as being a pandemic, tell us a little bit more about how the Centers for Disease Control here in the United States and the World Health Organization, how did they respond, start working together, and start really defining how we should, as a society, respond?
Well, historically, the CDC has worked with WHO, and in fact, CDC often shared staff people with WHO. And in the past, the United States had an office in China that would have recorded these kinds of things, but apparently that was changed for reasons that are not clear to me. But as a result, there was a little delay. So nevertheless, WHO did report to the federal government through the CDC. The CDC is tasked with being the recipient of this kind of information, and it works with the respective states in the United States. So as well, because each state has its own health department. We don't have a federal system of public health per se. Each state government is responsible for public health within that jurisdiction. So you have slightly different approaches to public health in each state. Nevertheless, CDC does use its platform to coordinate information with health officials in both states and counties. Remember, in some jurisdictions, counties play a major role in terms of deciding what goes on in public health. Depends on how large that particular county is. So county health departments and state health departments all work closely with the CDC to make sure that adequate information is available, and that something that's happening in New York that might harbinger something that's going to happen in California, that information is shared. And you need a central clearinghouse for that information. Remember, in the modern environment, people travel all the time. Airplanes, they go moving back and forth. So when you're dealing with an infectious disease, you're dealing with the disease that moves across boundaries. And so while we don't have a regulatory central authority at the federal level, because public health is a state-based responsibility, we do have the federal government sharing information, coordinating information, and making sure that information is readily available to state authorities and to county authorities. And that is a role that the CDC has. CDC also works at the federal level with the Food and Drug Administration, particularly when you're dealing with things like vaccines or diagnostic tests that have to be developed. So in the case of SARS-CoV-2, we needed to have a diagnostic test. So by mid-February, there were insufficient diagnostic tests available. The CDC did have an effort to develop diagnostic tests, and that apparently was a little slow because it has its own laboratories and working with the FDA. It wasn't until later in the month that they allowed state health departments to pursue diagnostic tests so that we could determine the presence and prevalence of SARS-CoV-2 or COVID-19 within our system.
Dr. Clark, talk with us about COVID-19 and how it impacts people of different ages differently. There seems to be a lot of confusion about that out there. The idea that young people can't get COVID-19, that older people get COVID-19 more, that children don't get COVID-19. Help us understand kind of what happens from an age perspective with respect to the risk of contracting COVID-19.
Well, I think it's safe to say that anybody can get COVID-19. Now, what your question suggests is there is a difference in the clinical presentation, and there are a difference in the risk factors. So you start off with anybody can get it, and the fiction that young people don't get it is causing a major problem. So young people get it, and the major problem is if you are an asymptomatic carrier, or even if you're symptomatic but your symptoms aren't that severe, you're walking around spreading the disease, and that's a problem. So people who are immunocompromised, which tend to be older people, in some cases people with other medical conditions like diabetes, or cancer, or hypertension, etc. What you wind up with is anybody along the age spectrum. So we have the most severe impact is with those who are very old, and then it goes from very old on the way down to very young. So children can get it. Young adults 18 to 29 tend to be more mobile, and a lot of them believe that they can't get it. They can. Right. And they do.
And they did.
And they did. When you get confirmed cases, you find that in one study, the largest cohort of confirmed COVID-19 cases was in the age range of 50 to 64. So they had over, at the time, they had over 484,000. But the next largest cohort was in the 18 to 29. They had 339,000. So there were fewer cases in the older population, in part because there was people started to isolate. But the death rate for people who are older, if you're greater than if you're 85 or older, the death rate is something like 300 per 1,000 cases, versus if you're 18 to 29, the death rate is like 1.1 deaths per 1,000 cases, which points out that anybody can get it, anybody can get sick, but older people tend to get sicker. Now, the notion of the asymptomatic carrier is that these young people who are often dependent on older people for resources may wind up, shall we say, compromising the health of those older people. They can't work, and therefore they can't get support.
Yeah. So you talked about, anybody can get it from an age standpoint, but at this point, 5-6 months into dealing with this COVID-19, at least in the United States, we're seeing trends where certain racial or ethnic demographics are being impacted greater than other communities. And can you just, before we move from this topic, can you just share a little bit about why that is?
Well, we have to keep
in mind can catch it
with a severe acute respiratory syndrome. So that means the next question is not only which age group, but the kinds of physical sensitivities you have. So if you've got a situation where people are living more closely together, you've got a situation where people's health is not as good as other people, then what we've wound up having is African Americans and Hispanics, as well as I've mentioned senior citizens, have a disproportionate impact. You also have the issue of nutrition, food deserts. So you've got these systemic inequities in our economy.
Mhm.
Then finally, if you're living in tenement houses or close proximity, then you're more likely to get it. And then you've got people in the criminal justice system, which are disproportionately Hispanic and African American in terms of dormitory facilities within the penal system, so they can get it. So we do have some structural inequities in our economy and in our society, which then leaves people of color, poor people, at greater risk.
I see. Thank you.
So how do we stop or slow down the spread of the disease? And it's interesting as I think about it, back in March, where everybody kind of turned on a dime and people started working from home, I personally had this view, okay, we'll be here for a little bit, and then by June, July, everything's good and we're all going to be back out there. And we've heard a lot about flattening the curve. So help us understand, first of all, what flattening the curve means. And then secondly, what we're seeing in terms of our ability to stop or slow down the progression of this disease.
Well, the whole notion of flattening the curve is the notion that was developed from the experiences of 1918, from the Spanish flu, which was also a worldwide pandemic. You get the healthcare system gets overwhelmed by presentations. People get sick. That minority of people who really get sick, they show up in the emergency room. They require additional resources. They require the hospital, the clinic to have what's called personal protective equipment. And so you get this reallocation of resources. So what you don't want is a highly infectious disease to spread and increase the demand on those facilities. What they were trying to achieve with what's sometimes called the lockdowns, the stay-at-home orders, however you want to characterize it, is to reduce the risk that people have getting exposed. You also had the issue of wearing the mask. Initially, there was some question about whether you should wear masks, and then it became clear that you needed to wear a mask because that question surfaced because we did not appreciate the infectivity of SARS-CoV-2. We just most recently, within the past 3 or 4 weeks, came to the conclusion that it was airborne. We didn't know that at the time. So the mask actually serves an additional purpose. But the key issue with this is, can you get citizens to cooperate? It all turns on the behavior of people. And as you pointed out, we all got tired of being locked down, shut out, shut down. They closed down our restaurants and we all wanted to go out and have a good meal. They closed down the bars and we wanted to go out and have a drink. They closed down the parks and we wanted to play baseball or soccer or football or tennis.
They just totally shut down the ability to socialize with anybody outside of your immediate family.
Indeed. And having done so, we sort of hemmed and hawed. Then it became political, but the undercurrents were we needed people to come to grips with the fact that we needed to change our behavior, that an infectious disease that causes for a minority of people some fairly profound conditions can be devastating to the community. And so after 2 months, the politicians relented, and hence we had the relaxation of these rules. The epidemiologists had predicted a wave. First wave would subside because if the lockdown, the isolation orders, the stay-at-home orders worked, the disease would subside, and then later we would have another wave, but that would come, say, in the fall or in the winter. Unfortunately, we're not moving from the first wave to the second wave. It's one great big wave. So because people started showing up, they made political statements, they had protests. And in other communities, they said, well, we're not political. We don't care about the protests, but we're going to the beach. The sun's out, the weather's nice, we're going to hang. And so those, combinations of protests. Then we had other protests happening because of social discord in our community. So want to go back to work. I'm tired of being at home. It's the political agenda, or I want to go swimming. We've found any number of reasons to go back to the status quo ante. And that meant the disease was spread. So some jurisdictions said you had to wear a mask. Other jurisdictions said you didn't. Some jurisdictions said you should stay at home. Other jurisdictions says, well, we're not sure. Most recently, one state said that we were not going to allow the counties to impose masks on our communities. Nobody needs to wear a mask. Well, it's an infectious disease that's spread by people talking to each other and spitting when they talk, or breathing when they talk,
or sneezing,
or coughing. So, I don't know if those of you who are older will not remember the Peanuts cartoon, a kid called Pigpen. This cloud around
this swirl
of dust and debris. Well, you should think of COVID as the same thing. When you walk into a room, you've got this little aura of infectious materials around you, and the mask keeps that contained. You don't.
The mask helps you keep your germs to yourself.
And yes, and it keeps you from being exposed to other people's germs. So you keep yours to yourself, and you're not exposed to other people's germs. So it's a twofer. Your stuff stays with you, other people's stuff stays with them, and so you are not exposed. And that is a very important thing. But if the attitude is I can't touch it, I can't smell it, I can't see it, it's not there, then you're unwilling to do that. You don't want to wear a mask. You want to hang. You just don't understand the importance of social distancing. Some places, like some of the big box stores, had things lined in supermarkets marked off 6 feet. People would just ignore the 6 feet.
Yeah.
They had little things on the floor. This is 6 feet from that. So
back up.
Back up. So the issue is, if we can't influence and convince people that part of dealing with this condition is personal responsibility, then we're going to have the ongoing problems. And we've seen that in jurisdictions that previously relaxed their rules, and then suddenly saw this uptick in people showing up in the emergency room and in hospitals. The ones who showed up, of course, were sicker, and they required resources to be allocated. So you now have hospitals in states that did not have the same level of problems overwhelmed. So key thing is we need everyone to own this as part of our obligations in our society, that wearing a mask is an inconvenience, but being deathly ill is more inconvenient.
So I heard you say wearing a mask, social distancing, step back, sometimes staying at home. Any other ways we can, or that we need to stop the spread of the disease?
Well, we should, of course, wash our hands. I don't want to forget the 20-second washing hands. So people have developed all sorts of timing things. Wash your hands for 20 seconds at least. Wash both the front, the back. Wash it between your fingers and your fingernails. Again, an inconvenience, but if you've ever been severely ill from anything, that inconvenience is overshadowed by the price you pay from being severely ill. And if you've got people in your family who are immunocompromised by any condition, then you don't want to be responsible for infecting them. And we've also got some young people who are discovering, much to their chagrin and dismay, that they themselves were immunocompromised. Because you don't always have to be severely ill to be immunocompromised. So we've got 25-year-olds and 30-year-olds and 40-year-olds who are dying from COVID-19 related conditions. And it's a real tragedy that we are trying to avoid, we need to avoid. And the only way we can avoid it is if we all hunker down and do what needs to be done. With that, you can go back to the store, you can go back to business, but you've got to be willing to do that. So if you're not willing to wipe down your surfaces, you're not willing to wash your hands, you're not willing to wear a mask, if you're not willing to identify whether you have symptoms early in the process, then you do have a problem, because you create a problem for the rest of us.
You know, we hear a lot about testing for COVID-19. What is the importance of testing? And also, if you could just tell us about the types of testing that that's available.
Well, first of all, we'll start with the two types. There are two tests to determine whether you have what's called an active infection. One is called the polymerase chain reaction, or PCR test. Another one is called the antigen test. The PCR test looks for pieces of the virus that causes COVID-19. It's a test that they look in the nose and the throat and other areas in the respiratory tract to determine if the person has an active infection. That's also true for the antigen test. That nasal swab is taken by a healthcare provider and tested. Sometimes if you've got a rapid test, it can be done while you wait. Other times it takes up to a week. The third test is what's called a serology test, or an antibody test. And this is from a blood sample that is taken and sent to a lab for testing. It tests whether you have a past infection. So the active test, the PCR test with the antigen test, lets you know whether you have an active infection or not. And if you test negative, it means that you don't currently have that infection, but you really do need to take care of yourself by using the things that Belinda talked about: mask, hand washing, social distancing, etc. Because just because you don't have it doesn't mean you can't get it. And that is an important point. Whereas the antibody test says you had it and that you now have antibodies as a result of having it. The problem with it's not the test, the problem with having antibodies is, for some diseases, if you got antibodies, you get immunity that lasts for a while. We're not sure about the SARS-CoV-2 situation. There has been some indication that you may only have immunity that lasts for a couple of months if you have it that. So we are still getting data. So the key issue is, if you have the antigen test, PCR test, or the antigen test, be careful you don't have it today, you might get it tomorrow. If you have the antibody test, be careful you had it. You're obviously better because you're walking around getting tested, but don't get cavalier about it. So those are the two tests. Those are the three tests that are given. So people develop, if you're going to become symptomatic, again, about 12 days from your exposure. So be careful. Those are the tests. The significance of the testing is it's often hard to get tests. I was just on a webinar earlier, and there was an island in Florida where everybody got tested. It's a private island, very rich people. They all managed to get tested.
Yeah.
And then there was the gentleman who did the presentation also pointed out there was a jail, and then it's not too far away. Nobody could get tested. And then early in the testing process, we heard, gee, Sam Smith from the NBA or John Doe from the hockey. They all got tested.
Like immediately.
Immediately, but nobody else could get tested. So the availability of testing is an issue. And then some people have to wait a week. I had a friend who waited a whole week and still hadn't heard about her test. So those are things that you have to take into consideration in terms of the resources available to make tests available. The United States started more slowly than other countries like South Korea, China. And so we had a situation where We didn't test, we didn't know, and people just weren't concerned. So now we've got more testing available. We really shouldn't blame the testing. We should use the testing as a way of informing us of what to do in our homes and in our community. So if you are negative from the PCR test or the antigen test, stay safe by social distancing, hand washing, wearing a mask. If you are positive, that means you have active infection. If you're asymptomatic, you still want to isolate for 2 weeks approximately to make sure you don't become symptomatic. If you're an asymptomatic carrier, even though you don't become symptomatic, that same 2 weeks applies because it means that you want to avoid exposing other people, young people, older people with your condition. It has had substantial impact. People can't go to weddings, people can't go to funerals. So people are being inventive, Zoom weddings, Zoom funerals, or postponed graduation ceremonies. People are figuring it out. And other people are saying, what me worry, and they go party. There was a case where some young people were having, shall we say, exposure parties. Let's have a COVID-19 party and see who gets the infection first. You know, it was fairly daring.
Yeah. So let's take a step back and look at this. So we've got this infectious disease. We've got evidence that it's spreading very quickly and that it's presenting itself globally. It has, in effect, shut down economies across the world. Businesses can't operate, schools can't operate. And we're being told how you can stop it from spreading. We're also being told that there is some form of testing and they're trying to find, I guess, a cure for it. So how long does this last? What should we expect moving forward? And just as a country, the US, are we winning the war against this virus or are we losing?
Fortunately, you get a jurisdiction by jurisdiction response. So some states are doing very well. Other states are not doing so well. Some states, people are cooperating, and that's why they're doing well. Other states, people are saying, I'm tired of all of this social isolation and not being able to go to the bar and not being able to party, so you're not getting that cooperation. So as you pointed out earlier, some states like Texas and Arizona and Florida seem to be moving in the right direction, and then boom, the parties started to happen. So people value the economy over their public health, and we recognize that there is this balancing act that you have to do. But the balancing act, the economy is preserved by people cooperating. If people are not going to cooperate, so the only way I can go to a bar is to expose myself to everybody else, then that's a problem. The only way I go to a restaurant is to expose myself to everybody else, that's a problem. And it's having a substantial impact. Because from a workplace perspective, who's responsible for those people? So those states that shut down and now that their hospitals are being taxed, they've had to step back and say, oh, wait a minute. We thought this was about civil liberties. We thought this was about the Constitution. It is really about an infectious disease, which is not in any place I can find in the Constitution or the Bill of Rights.
Well, let's talk about cure. I mean, there's a lot of talk about a virus. Like back in March, everybody was talking about, oh, we're going to have a virus. You know, we're going to have a cure real soon. There's going to be a virus. So why don't you talk to us about the reality of what it takes to identify a virus that will be effective against a COVID-19 and what the prospects are for doing that anytime soon.
Well, again, this is still evolving. I want to make that point clear because I don't want to be pessimistic and I don't want to be optimistic. We want to be careful. A vaccine, there are over 120 candidates for vaccines and people are working, drug companies are working on it. It's being worked on across the world. So if we're not careful, the first vaccines may not be as successful as we would like to think. On the other hand, they may be more successful. So the question is, will those 120 candidates produce what we need for them to produce? Can't answer that. If we've got a dozen candidates for a vaccine that are in clinical trials, then we can expect within the next 6 months to a year to have possibilities. And that's what we're looking at. You have to go through the FDA. There's a rational structure to these things because, as you know, people often rush out and say they have a cure, and then it turns out they don't. They have a treatment. It turns out they don't. The treatment is worse than the disease. So we have all of these things that we have to deal with. So the FDA, by definition, is trying to move carefully and deliberately, but quickly, if we can have all of those words in the same voice.
All that at one time.
All of that at one time. So there are these dozen candidates in various phases of the FDA trial. So our hope is that we will have something in the next 6 months to a year. But in a sense, it's kind of meaningless because what we should be learning from this is, as the phrase goes, we're all in this together. We are all in this together. I don't care whether you're in the hollows of Appalachia, the barrios of Los Angeles, the ghettos or the neighborhoods of Washington, D.C., however you want to characterize it, private islands. Unless you really want to stay in your home 24/7, you're going to interact with other people. And as long as you interact with other people, you're dependent on those other people doing what they're supposed to do. And that's what we've learned from air travel, train travel, buses, planes. You don't know who's going to get it. As you see in the media, rich people have gotten it, poor people have gotten it, old people have gotten it, young people have gotten it. And so this notion that I can run and hide is a fiction. Right. Or as they say, you can run, but you can't hide.
Can't hide.
Yeah.
Well, we've seen by now that obviously the United States is struggling with this because we've had, some big cities and some states, we've had them, try to phase into opening up, and then they had to pull back and retreat and shut down again because of spikes in the disease. But we've also seen countries outside of the United States who have been able to at least arrest the spread of it. If not, we know there's no cure, but they've arrested the spread enough to open back up their economies. What's the biggest difference between what we're experiencing there and what these other countries who were able to open up have done? What's the biggest difference? And how can we get to that?
Yeah. Quick.
Well, back to we're all in this together phrase. We in the United States value our personal liberty, value our ability to do whatever it is we want to do, as long as we're not, quote, hurting anybody else, to the extent where that's a problem in an area where infectious disease is applicable. So we've got countries like Finland that have a few cases. They managed to get it under control. Cambodia, Cyprus, Iceland, Ireland, Jamaica, Jordan, Latvia, Lithuania, Cuba, Cambodia, as I mentioned, they're doing it. And then we've got the United States. We've got some Nordic countries that are trying to do it, that they're making progress. So Canada, Austria, China, France, Germany, Italy, they're doing it. And then you've got the United States. So you have to ask, and the United States is not alone in not doing well. The United States ranks up there with Brazil and Bulgaria and Chile and Colombia and Bolivia, Armenia and Argentina. But we've got the greatest nation in the world, and we're not doing it. We're not doing it because, as you found out when these other states renewed their restrictions because people went whole hog and said, I'm not going to wash my hands. I'm not going to wear a mask. I'm not going to socially distance. So there. Well, they're not doing it. So if you want to know how we're going to change the outcome of this pandemic, then we have to change our respective behaviors. We all have to own it, and we all have to say we have to do our share.
Yeah.
Fortunately, most people are doing it. The problem is you need more than most people doing it. You need a lot of people doing it.
Yeah.
You need everybody actually to do it. So,
you know, there are just so many questions as employers, as communities struggle with what do we do? I mean, school systems, for example, going back to school in the fall, kind of the political football right now of, oh yes, we want students in the classroom in the fall versus, that looks pretty risky. What are some of the factors that organizations should consider in assessing the risk?
well, you have to look at your workplace and you have to look at your workforce. So your target population, both WHO and CDC and coupled with OSHA have guidelines that companies should look at if they're going to address this as an issue. But you start with workplace, workforce, and your context. So if you interact with a lot of customers because you are retail activity, that requires one approach. If you are manufacturing activity, that may require another approach. Back to the issue of people having an opportunity to wash their hands, people have an opportunity to wear the mask, people have an opportunity to socially distance, people have an opportunity to wipe down their work site. Can you do that? What some universities are doing, I'm a professor at Santa Clara University, we are allowing some professors to teach remotely. So, and in fact, part of the lockdown had a number of employees who were working remotely. So if you've got type of economy in your workplace where people can work remotely, then your question is, well, should we continue that? If they can't do that because you are retail, for instance, and you've got to peddle your products with face-to-face, that's an issue. So you need a different strategy. If you've got a mixed business where you can do some remote and some face-to-face, then that face-to-face has to deal with the issue of disease containment or infection containment, infection control.
What do you think the university systems need to do? You're in a university system, and we all know, half of college life is academic affairs and the other half is student affairs, and both of them provide knowledge and growth during those years that you're matriculating. And so how do we do this? How do university systems achieve this under these circumstances?
The issue is risk management. There's a zero risk possibility. There is no zero risk possibility. You can't have a situation where there's zero risk. So what can the universities do? They're proposing to do exactly what we've been talking about. Have some classes move online, reduce the volume of students in any situation, use shields so that professors aren't exposed to the students or the students aren't exposed to each other.
So that's the academic side. What about the whole student affairs side? Everything else associated with the college experience.
Okay, you want to separate your college's university from your elementary, junior, middle school, and high school. Because by the time you're 18, what? You telling me what to do? You've got people who view themselves as adults and they're going to do what they want to do. So part of what we're trying to do is infuse them with the notion of personal responsibility.
Yeah. Well, I don't want to beat this into the ground, but I will tell you that part of the sale job as a parent of a recent high school grad, part of the sale job of universities are these wonderful 21st century living and learning communities.
Mhm.
And so the whole living part is a huge, huge piece. And you know, we're paying for that. That's you
That's what
know,
you're paying for, and that's what you want, and that's
yeah.
what your children want. They want that to get the heck out of Dodge. So, but the schools also have a responsibility. So
Safety.
that responsibility is not just their responsibility. As a parent, you need to make sure, let's say you're a high school student going to college, that they're aware of these realities. And so the question is, can they contain themselves? Can they behave responsibly? And maybe this will be the true test. Remember, this is a case of first impression. Not since 1918 have we dealt with this. You should ask, well, how did we deal with the flu? Well, they didn't deal with the flu because, you know, I've been to many universities. We never really adequately dealt with the flu. We had the swine flu, we had the this flu, and then that flu. We didn't deal with the flu. H1N1, we didn't deal with the flu.
Mm-hmm.
But we have to deal with this one.
Yeah.
So if you would think about it, how many of the college presidents, the professors, the fraternities and sororities were dealing with this in 1918?
Yeah, exactly.
Yeah.
Exactly.
So it's a case of first impression. So if we're going to, if we pursue it looking for who's responsible for the problem, then we've got a problem by ourselves. If we pursue it as that we're all in this together, and I hate using that phrase, it's almost trite, but it's true, then we all have a responsibility. And that's the only way we're going to keep these infectious diseases from affecting us, because right now we've got SARS-CoV-2. What about SARS-CoV-3 or some other infectious disease? If we don't have these themes of we're all in it together and we all need to do some things, then we've got a problem. And just because you're 22 and healthy doesn't mean that you can't be a silent carrier or you can't get the disease. So what should you be doing?
Yeah. You know, in future episodes, we're going to be talking more about what employers should be doing, but certainly flexibility has got to be a key in terms of addressing issues. And, you know, it's almost an employer by employer response to some extent, depending on the kind of workforce, the kind of workplace. It's been my observation that many employers who are able to allow people to continue to work from home have said, okay, we're going to be flexible. You can continue to work from home. But I do think that flexibility is certainly going to be key in going forward. A couple of other technical things I wanted to ask you about. Talk to us about contact tracing, because that's something that employers are looking at. You know, there's contact tracing, there's taking temperatures. You know, what are some of the scientific, you know, things out there that employers should be doing to act responsibly? So let's start with contact tracing.
If you test positive, then and if you're at an Orthodox facility, then your name would be turned over to the health department. The health department will assign someone to interview you so that they can determine the circumstances and the conditions under which you might have been exposed. Remember, a lot of people depends on their behavior. So if I went to a wild and unruly party with 50 people, I may not remember who was there. But the whole notion of contact tracing is you track down all the people who were possibly exposed. And if they get tested, then you determine the prevalence of the exposure. So if I know Sam Smith is positive, and he was at the party, or he was at the workplace, or he was at wherever, then what I do from there is to find out whoever Sam Smith interacted with. So that's where the contact tracing comes in. And then you go from that person to that person. So you have this whole web cascade of interactions so that you get a better sense of the prevalence of the disease, the infectivity of the disease, and what's going on in our community. So if 50 people were there and only Sam and Susie got converted, that means that the disease isn't spreading that rapidly in this particular population. If 50 people were there and 15 people got converted, then and that event was the only event to which you could attribute that conversion, then you realize that you've got something that's more infectious. Remember, you also are dealing with a virus that can mutate. So you also need to be able to keep that in mind. So part of this whole effort is to track down somebody who may have been exposed. Were you on that plane? Were you in that car? Were you on that bus? Were you at that party? Were you at that event? And to see how many other people were infected, because those people can go on and infect other people. So I inform you, you were positive, you need to chill out for 2 weeks. That becomes an important thing, but you don't know that if, and we've had cases where people just merrily went along their way, they've been exposed, they converted, and then they go and they expose other people, some of whom may be very vulnerable. So.
Right. So it's like a multiplying effect.
It's a multiplying effect. That's right.
Yeah.
It's definitely a multiplying effect, and it's a major concern. So with contact tracing, we can address that issue. Now, the employer doesn't do the contact tracing normally. That's generally delegated because there are confidentiality issues. There are all sorts of other issues. What some employers are doing is doing the temperature check, which is not a great way. It is something, but it's not really a reliable way of determining whether someone has been exposed, is a carrier. But it is, if someone is symptomatic, that's helpful from that point of view. You can send them back home, but it's not a foolproof technique. But it does show that the employer is doing the best he or she can to address the issue. Because again, we're all in this together, and we want employers to be responsible and flexible, but they can only behave, you can only do so much.
Yeah, I think a lot of the employers who have started returning their workforce back to a workplace environment are taking baby steps. I recently had an experience in the TV and film industry where they opened the set back up, and they had extreme steps that they were taking, not only to test, to do a temperature test of everyone entering the set, but keeping people socially distanced while on set, as well as doing periodic safety briefings to remind people, more than one safety briefing a day to remind everyone what it is we needed to do. But nevertheless, there's still a lot of employers who are still trying to sort it out. And I think that's what we're going to be talking about in our next episode. Right, Barbara?
Yes, absolutely.
Information, sharing that information and making that information readily available. And I like this notion that you describe of constantly reminding people of this. Because again, we're lax and we want to hang out with our friends. We want to chit chat and as well as get the job done. And we need to be reminded. That way you minimize the risk.
Yeah, it certainly represents a huge social and cultural shift that not only we will have to make and practice in our personal lives, but absolutely in the workplace.
And depending upon where you work and what you do and the work population, your workforce, you may have these cultural dynamics that people find hard to transcend. And so you have to take that into consideration. So if you've got people with cultural rituals that they hate to break, then you've got to speak to that, because the workplace then becomes a place for communication.
Well, certainly, we encourage employers to look at science, which is part of the reason we're talking with you today. What are some of the best sources of information for employers to go to for reliable scientific information on what's going on? what guidance can you give? Because there's so many myths out there. I know, you know, I'm sure that both of you, like me, heard all kinds of conspiracy theories. And is it 5G? I mean, there are just so many theories out there
Yeah.
that were coming at us left and right. So if you want reliable information, where do you go?
All right, that's a very good point. So depending on your staffing pattern, you would have someone check at least weekly. The CDC, it has information both for professionals, well, actually, from professionals, for employers, for consumers. So it's all broken down and it's all available. So if you are somebody who's very knowledgeable and you don't think that getting information in simple terms befits you, then you can step up. WHO, same thing. Information for professionals, information for employers, the business community, and government officials, information for consumers. If you want to know the most recent data, Johns Hopkins University has a website. You have some newspapers who are capturing the information from the CDC and WHO and the academic literature. So those websites also contain information. Your state health departments often are information brokers, so you can get information from the state health department. Just put in state health department in your state. If you're from Maryland, if you're from Idaho, if you're from California, if you're from Texas, you'll find a wealth of information about COVID-19 on those websites. And some of that state-based websites will also give you information about where you can get your COVID-19 test. So good information from CDC, state health departments, and WHO. Other information, a number of your popular media sites are tracking this. Now, the problem with the further away you get from the health departments, the CDC and WHO, you start getting into the conspiracy theories and you find people just pretending that it isn't true. And we've had certain situations where these pundits have, talked about the disease as if it was a fiction and then, oops, they get it themselves.
Or their family member.
Or their family member gets it. So, and then they're singing a slightly different song. But so I think people need to use the official sites. And then, if you want to listen to the conspiracy theories, you can. But protect yourself. And then you can have a debate whether enough resources were made available, whether this political party versus that political party moved fast enough or didn't move, et cetera. But as citizens and as employers, in businesses, you want to deal with what's best for your particular group, and denying that there's no pandemic is a surefire way of causing havoc in your workforce.
One of the challenges, if you're a multi-state employer or even a global employer, is just trying to figure out what's going on in various jurisdictions. And I know that there are some organizations, some law firms that are tracking exactly what's going on in terms of the stay-at-home orders, the quarantines, whatever. And we'll post those to our website so that folks can take a look at those, because it's so challenging if you have employees in a variety of jurisdictions, even to know, okay, well, these people can't go to work, these people can't go to work. These, it's quite challenging.
And indeed. So depending upon the employer, if you are doing business in only a few countries, those countries will probably have websites. Also, the issue is the information in a language you can understand. So this is where your consultants and law firms might be helpful. They can translate or arrange to have translated that information. You want to make sure you're able to read it. WHO often will do the translations. So again, multiple responsible sites focusing on the science and the public health, focusing on what the communities are doing, and so that's helpful.
What's your view about travel? I mean, a lot of employers have pretty much stopped non-essential travel through the end of the year in some cases. What is the risk of, say, airline travel at this point?
Well, it's now that we know that this is an airborne disease, traveling in an airplane is at a higher risk. Some airlines have made efforts to allow as many people as reasonable to travel. Southwest puts people every other seat. Other airlines have been chock full of bodies. Some airlines have insisted that you wear a mask in order to board. Other airlines are more interested in the cost of the seat. So they allow people to not wear masks. So it is more hazardous, but if you got to travel, you got to travel. So again, your risk goes up.
But again, when you think about the impact on businesses, particularly those who operate globally or those who operate, across multiple states in the United States, with these individual jurisdictions putting in place rules on who can and cannot come into the jurisdiction, I mean, that's totally changed up some of the mobility, the mobility culture that a lot of corporations have followed in terms of having, multinational, business units where they have one executive that travels between countries and things like that. Well, now that executive, if he's originating in the United States, there's a whole bunch of countries right now that are not going to allow anyone from the United States to come in.
But that's Barbara's point. You need somebody who's tracking that, because if they're not going to accept me, I'm not going. So the issue isn't that. The issue is, if they do accept me, what's my risk? So if the country insists on a quarantine, Israel was requiring, and I don't know if that's still in effect, it was requiring a 14-day quarantine.
Yeah. So like South Korea, my daughter is stationed over in South Korea. She's been over there since July with the United States Army, and her husband had to finish up his tour of duty here in the United States. So he just recently, this past weekend, was able to actually move to South Korea and start a new assignment there with his family. His first 14 days there, he literally is under quarantine in some barracks. So he can't join his family immediately. He has to stay in the barracks. And as a funny side note, my daughter happens to be head of the human resources organization that intakes all of the soldiers. And so any soldier coming into the peninsula reports into her for the first 14 days. And so we just were having a good laugh in the family about how her husband now has to report to her for the first 14 days that he's over there.
So, but that's exactly the point. So you do, as Barbara pointed out, and as you're observing, you need to know what the host country's policies are. Mm-hmm. But you also need to know the risk. Even if the host country says, fine, come on in, then the question is, who are these other people that are on the plane? Who am I traveling with, who have nothing to do with my company? What policies do they have? Do they wipe down the plane? Now, there are some people who very wisely advise you to make sure you have hand
your own, right?
And your wipes, and you wipe down your, now, depending on who you see yourself as being, I mean, if you're flying first class, do you do something as tacky as wipe down your whole area? Well, you get
nothing
sick.
Tacky about that nowadays.
If you get sick, then that first class trip suddenly loses its appeal because you're deathly ill. So that's why some people do that. So they bring their own water. They make sure they get water at the airport, bottled water, and not on the plane. Southwest no longer hands out the multiple snacks they used to hand out. Mm-hmm. Others are using sort of meals ready to eat.
MREs.
As a way of dealing with it. So again, you want to check out the airline before you get on it. You want to check out the train before you get on it. You want to know what their policies are. If they've got very casual policies where people are sitting any place they want, they don't have to wear a mask, then that's a much more hazardous situation. If they've got more restrictive policies, that's less hazardous. Nevertheless, your risk goes up because you have the issue of airborne, you have the issue of surface contact, how long the virus remains on a surface, that's an issue.
Well, it's certainly a lot. And as we mentioned earlier, employers definitely will have to turn a practical eye towards the workplace environment and reimagining it and redefining it in this post-COVID-19 existence that looks like we're going to be in for a while.
Well, it can last up to 2 years. So yes, it will be a while. We've got to get through the flu season, i.e. distinguishing between COVID, SARS-CoV-2, and the annual flu, which can have 2 or 3 permutations. Right. So you're not, people who get the flu vaccine will often complain that, gee, I had the vaccine and I still have the flu, which shows you the limitations of vaccines. If the thing mutates, then you got a new version.
A new strain.
A new strain. So we will know a lot more after this first year. The whole notion of communication, information, tracking, and personal behavior, as well as employer behavior, becomes critical. And so, again, we're all in this together, again, using that phrase, and it means that everybody has a task to perform. Employees have a task to perform, employers have a task to perform, public health authorities have a task to perform, government authorities have a task to perform. And depending on how well each of those does his or her task, we will determine how well we do in the long run with regard to this pandemic.
You know, Dr. Clark has made it clear that the COVID-19 has presented one of the greatest challenges that we've had to face in our lifetimes, for sure. And certainly employers are really going to struggle, have struggled, and will continue to struggle with what the best approach is to maintaining a workforce, keeping their folks working. How do you do that? And, you know, we can look at regulations, whether it be EEOC regulations, OSHA regulations, the Department of Labor regulations, in terms of giving some guidance. But going back to what I said earlier, it's really a matter of flexibility and understanding what's going on from a scientific perspective, as well as looking at what's going on in terms of the guidance that we're getting from these various agencies on how to proceed.
Yeah, I think thinking outside of the box is going to be a very necessary practice that employers, as well as the people who advise them, like their HR teams and their legal teams, will have to do moving forward.
Sure.
And avoid succumbing to the mythologies associated with this. Do these practical things that we've been talking about. And then I'm sure when you two start talking about the regulatory and the legal issues, the practical things will help address those issues.
Well, in our next episode, we're going to take a closer look at a list of the adjustments and the precautions that will now define today's workplace in this post-coronavirus era that we're in.
And we'd certainly like to thank Dr. Clark for providing us with so much valuable information and insights about COVID-19 from a scientific perspective. It's very valuable for employers to understand this science. And so thank you so much for joining us today.
Yes.
Pleasure's mine.
Thank you, Dr. Clark.
Pleasure's mine.
You've been listening to Today's Workplace with Barbara Johnson and Belinda Reed-Shannon. If you like what you heard, click subscribe so you don't miss out on future updates and episodes. For more information about today's episode, check out todaysworkplace.com. That's TODAYSWORKPLACE.com.